So we're talking about dog bites and how risk is assessed. And I'm really grateful to this commenter for giving me the opportunity to talk in more depth about some of these aspects. There are a lot of good places to dive in here, so I'm just going to unpack them one at a time. So one of the things we talked about in the last video is how there can be a lack of nuance around some of these conversations on the internet. And that's one of the reasons I wanted to talk about some of the factors that we consider when assessing risk in relation to a dog bite. And one of those ideas is the idea that when a dog bites someone, it is always the person's fault. This ties back to the idea of it's all how they're raised, in part. And so the idea is that if a dog is behaving aggressively, it's because they've been abused or neglected, or it's because in the moment someone was not respecting their boundaries, ignored their warning signs, and insisted on doing something that the dog did not want to happen. So first is the idea of we kind of call it, it's all how they're raised. And that's the idea that dogs with behavior problems are dogs who have been abused or neglected. And that is just simply not the case in actuality. There are many, many factors that influence behavior, including aggressive behavior. Of those factors, one umbrella might be the dog's lived experience, the nurture part of the nature versus nurture debate. And of course, we know that it's nature and nurture. And so of those lived experiences, experiences with their human is a part of that. And what's important in those experiences is how the dog experiences them, not necessarily the human's intent. And so, yes, if a dog repeatedly has negative experiences, they can create a negative association, and that can result in aggressive behavior, often from a place of fear. But that doesn't necessarily mean abuse and neglect. That can mean that the dog goes to the vet and the dog is scared at the vet, and the dog has repeated experiences at the vet where they are afraid because stressful things are happening, not because anyone is intentionally doing anything malicious to the dog. And then after repeated exposure and after receiving care when they've asked more quietly for those interactions to stop, the dog may escalate to aggressive behavior. And so intent is not as important as the dog's experience of the event. And those experiences with people are just one factor. There's also how the dog feels in their body. Up to 80% of cases involving aggression involve pain, either directly or indirectly. We know that things like conditions in utero, birth order, maternal care, these types of factors, epigenetics, maternal stress during pregnancy, these types of factors influence behavior. And so it is far more complicated than it's all how they're raised. If dogs who behaved aggressively all had people who were treating them poorly in their lives, I would not have clients because people whose dogs were displaying aggressive behavior would not be seeking out my support. The other idea that we're talking about is boundaries being ignored. So this commenter talks about being 7 years old and being bitten by a dog when they reach to pet a strange dog on the belly. And they say this was an idiotic move. And I just want to say that it was not an idiotic move. This commenter was 7. 7-year-olds are not idiots. They just behave in developmentally appropriate ways. And that's why it is our job as guardians of those pets and as parents to children to keep everyone safe, to keep those that we are responsible for safe. And so certainly a lot of bites do occur because of miscommunications. So that dog at the vet, for example, is trying to communicate that they don't want something done. Those lower levels of distress are often missed. And so the dog may be mistaken as being fine. And then as the distress gets a bit louder, it may be more obvious, but we may push through because we think the dog will get used to it, or because we think that the care needs to happen right now, and that it's worth that, or we may miss those signals still entirely, and then we may see an escalation. Or it could be that we're, engaging with the dog in a way that we think that they enjoy and that they like, and then it turns out they don't like that. A big confusion is dogs will approach a person, and we think that means they want pets, and we pet them, and it turns out that they were actually really nervous and trying to gather more information, and then they're surprised by the hand coming down and they bite. So absolutely that can happen, and in a lot of cases, the majority of cases, these are situations where we can improve communication between the species and help everyone's needs to be met and greatly reduce the risk of an aggressive incident in the future. But in some cases, and I see this more in the types of cases that I work than you are going to see in the general population, absolutely, because I work with dysregulated dogs and I work with aggression specifically. We may have situations where it is difficult to manage the aggressive behavior. The dog may be triggered to high levels of stress, which may include aggressive behavior, over everyday occurrences and over things that we may have a lot of trouble predicting or predicting in enough time to react and avoid the aggressive behavior. And it's true that this is not the case for the vast majority of dogs who display aggressive behavior, but this definitely can be the case. It's more likely to be the case in cases of complex behavior cases. So for example, I once worked with a dog who would resource guard small things that he found on the floor. And he was a very, very large dog, and he might be laying on top of them. So he could be, for example, resource guarding a paper clip that he was lying on top of. And you wouldn't even know that he was resource guarding anything. He might be laying there resting, sleeping, and then you would just be walking around the house and he might aggress. And it's very difficult to live life well in a home where you are afraid to walk near your dog. And are there things that we can do to support that dog? Yes, almost certainly. But the question is, will that reduce the level of risk to the humans to a level that they find acceptable, to a level that they can quite literally live with? And the answer is going to be different for everyone. Often in these sorts of situations, when we're talking about the types of cases and situations I'm talking about, or in the last video we were talking a little bit about like cases that tend to go viral because they're very high levels of injury to the human. In those types of cases, these are generally not one-off bites. These are generally not dogs who are dealing with one trigger. These are generally dogs where we would consider the case a complex behavior case. And not all complex behavior cases even involve aggression, but there are dogs who display aggressive behaviors and they live with baseline stress levels that are higher than ideal, and they struggle with resilience to stress, and they struggle with accessing appropriate coping skills. And based on the factors that I described in the last video, part of going down a behavior therapy route with those dogs is making sure that the people living with them understand the risk in that individual case and are able to make their choices in an informed way. They deserve informed consent. And so you certainly could have a dog who has an ear infection and someone touches their ear and they bite at a level 2 or maybe even a level 3, and then you address the ear infection, and maybe that dog never bites again. But let's say that same dog, has an ear infection, and that is the catalyst to them, charging 20 feet across the room to bite someone at a higher level. An uninhibited bite, and these are not common. These are not normal. This is not within the typical range of what we expect from dog bites. We can have a lot of compassion and say this dog had an ear infection. But we can also say, wow, this is a high level of risk. Things are going to happen. Dogs are going to experience pain. They might get sick. Stress might occur. And if this is the potential fallout for typical life stressors occurring, this may not be an acceptable level of risk to continue with. And so it's not a black and white situation. We can hold a lot of grace and empathy for the dog's behavior and at the same time decide that the level of risk either to the dog themselves or to the community or to the family is not an acceptable level of risk. I do want to stress this is not the vast majority of dog bites, and the vast majority of dogs do not bite in their lifetime. But I think precisely the point is that often in these higher level cases, we're not talking about dogs who are responding typically to stress. And that doesn't make them bad dogs, but it also might not make the level of risk acceptable.